Welcome to Mind Mentor. In this video, we will discuss about the common cold. It often simply referred to as a cold, is a highly contagious viral infection of the upper respiratory tract. It is one of the most frequent illnesses in humans, and it is primarily caused by rhinoviruses, though other viruses such as coronaviruses and adenoviruses can also be responsible. Here is a detailed explanation of the common cold. 1. Transmission. The common cold is typically transmitted from person to person through respiratory droplets when an infected individual coughs or sneezes. It can also spread by touching contaminated surfaces or objects and then touching your face, especially the nose, mouth, or eyes. 2. Symptoms. Common cold symptoms typically appear 1 to 3 days after exposure to the virus and can last for about a week. The most common symptoms include runny or stuffy nose, sneezing, coughing, sore throat, watery eyes, mild headache, fatigue, low-grade fever, rare in adults, more common in children, and mild body aches. These symptoms are usually mild, and individuals with a cold can usually go about their daily activities. Severe complications are rare but can occur in people with weakened immune systems, infants, and the elderly. 3. Diagnosis. The diagnosis of a common cold is often based on the presence of characteristic symptoms. Laboratory tests are not typically necessary for diagnosing a cold. However, in cases where the symptoms are severe, persistent, or unusual, a healthcare provider may consider testing for other respiratory viruses or bacterial infections. 4. Treatment. There is no cure for the common cold. Treatment primarily focuses on relieving the symptoms and supporting the body's natural healing process. Common treatments and remedies include rest and hydration, over-the-counter, OTC cold medications to relieve specific symptoms, e.g. decongestants, antihistamines, pain relievers, gargling with warm salt water for a sore throat, using saline nasal sprays or a humidifier to alleviate congestion, drinking hot liquids like tea or chicken soup to soothe a sore throat and relieve congestion, cough drops or lozenges for throat irritation. 5. Preventing the common cold involves good hygiene practices and avoiding close contact with infected individuals. Some preventive measures include frequent hand washing with soap and water for at least 20 seconds, using hand sanitizer with at least 60% alcohol when soap and water are not available, avoiding close contact with sick individuals, covering your mouth and nose when sneezing or coughing, disposing of used tissues properly, cleaning and disinfecting frequently touched surfaces. 6. Complications. Most colds resolve on their own without complications. However, in some cases, especially in individuals with weakened immune systems, a cold can lead to more severe respiratory infections, such as bronchitis or pneumonia. In summary, the common cold is a viral infection of the upper respiratory tract characterized by mild symptoms like a runny nose, cough, and sore throat. It is typically a self-limiting illness that resolves within a week with rest and supportive care. Prevention through good hygiene and avoiding close contact with sick individuals is key to reducing the risk of contracting or spreading the common cold. Is this conversation helpful? Please like and subscribe to our channel Mind Mentor.